Thank you for joining us for Section 2 of the APS Basic Skills Pre-Service presentations. This section is the 8 Guiding Ethics and Principles of Adult Protective Services. I am Laura Gerganis, and I am a Program Coordinator for Adult Protective Services with the North Carolina Division of Aging and Adult Services. This presentation today is a general educational experience. It is not intended as legal advice or case-specific guidance, but rather is a basic skills overview. Specific cases can be discussed with a Division of Aging and Adult Services representative upon request through the listserv. While the guidance provided during this presentation is based upon information available during its development, the accuracy of its elements are subject to change based on updates in law, administrative code, and state policy. This presentation is intended to be viewed prior to completing the face-to-face classroom training and should not be considered a substitute for the entire Adult Protective Services training module. Welcome to Section 2 of Pre-Service. The objectives for this part of the presentation are for you to develop a baseline understanding of the ethics guiding our work in Adult Protective Services. Ethics are a branch of philosophy dealing with values of human conduct and are useful in determining the rightness of decisions or the fairness of a decision-making process. Ethics are interwoven within the guiding values or principles of Adult Protective Services. The 8 basic principles of APS should guide your work on a daily basis when working with this population. Working with adults can be challenging and is much different than working with children. The policies are different and the decision-making is different. Applying these principles will assist you in that process as you navigate the increasingly diverse landscape of service provision. Let's begin discussing these foundational values. What is most critical for you to understand as an APS social worker is that every action you take in APS must balance your duty to protect the adult versus the adult's right to self-determination. It is important to remember that what we want and what they want can be significantly different. This principle is as foundational to our work as being able to define disability that we discussed in the first section. Adults have the right to make choices governing their lives and can absolutely refuse our services if they have capacity to do so. It is paramount that you remember and validate to yourself just how difficult it is to have to walk away. Take a moment to consider a time, if you have one, where you had to walk away from someone who really needed your help but didn't want it. How difficult was that for you? Did you try other mechanisms or interventions before walking away? We will continue to cover the adult's right to self-determination throughout this presentation, as well as in classroom training. Let's now move on to identifying the 8 different principles governing our work every day. Noted on this slide are the first 4 principles of Adult Protective Services. We will go over each one in detail. Number 1 is the right to self-determination. Number 2, adults should be treated with honesty, care, and respect. Number 3, the least restrictive alternative should be used whenever possible. Number 4, give highest priority to the family and other normal support systems as viable resources when appropriate. Here are the remaining 4 principles, starting with number 5, inadequate or inappropriate intervention can be more harmful than none at all. Number 6, protection of disabled adults is a shared community responsibility. Number 7, the emphasis in APS is always on the need for protective services rather than investigation of incidents. And finally, number 8, the adult's confidentiality and right to privacy should always be respected. Now that we have identified each principle, let's break down each one and talk about its applicability to APS. As we discussed a few slides ago, adults have the fundamental right to self-determination. It is our primary and most critical principle. Take a moment to consider if you have ever made a poor decision or one that you regretted. Now try to imagine that someone tried to force services on you or took away your ability to make choices because of that decision. Imagine for a moment what that may feel like. A good example for this illustration is hoarding. We may not agree with the status of that living environment, but the adult may choose to live that way. They should be able to demonstrate appropriate decision making and that their decisions are voluntary, intentional, and not due to coercion or duress. An eccentric lifestyle does not equal poor self-determination. It is not our place to judge the life choices of another. However, we also want to validate how excruciating it is to walk away from someone we feel needs us. Always place in the forefront of your social work practice that adults have the right to make their own choices and decisions. Our second principle is always treating an adult with respect, being honest with that adult, and caring for them. As well as an adult having the right to make their own choices, comes the right to also expect others to tell them the truth and be responsible for their own actions. The golden rule isn't always so golden. How we like to be treated may not be the same standard for everyone. We may expect respect and take offense to someone yelling at us, while some of the adults you serve simply may not mind, or in their own family's dynamic, it is the norm. Adults also have the right to expect others to expose deception and irresponsibility of others. They may not like hearing it, but they have the right to hear it. We as social workers are accountable and responsible for our actions. You may not be able to control the adult's response, but you can always control yours. You should never make an encounter personal. Remove your own emotions. Be compassionate without crossing a boundary. APS is extremely intrusive and to some adults embarrassing. Dignity and respect during visits are paramount. Older adults inherently fear placements or sometimes even the government. Be aware of these feelings while also being open and honest. Answer their questions as best you can. Our third principle is that the least restrictive alternative should always be used when evaluating or mobilizing services. Adults have the right to expect others to first do no harm in the maintenance or enhancement of their welfare. This is a concept commonly known in medical circles as non-maleficence. How many times have we heard a child or caretaker state, well, they just need to be placed? Although that person may be at wit's end or burnt out, we should also not jump to that same conclusion. We should never put services or evaluations in place because an adult is too hard to deal with. Adults should be involved in their own service planning to the highest extent possible. As we stated before, we must remove our own biases of what we think is best for that adult. The least restrictive environment doesn't look the same for every adult, and the social worker should avoid acting in a way that inflicts harm. Some good examples of this concept include considering in-home aid services or special assistance in-home versus a placement in an assisted living or group home. Adults can decompensate quickly when placed versus thriving with simple in-home services. Our fourth principle is that highest priority should always be given to family or other healthy, natural support systems. Adults have the right to be given the opportunity for their own supports to demonstrate their loyalty and commitment to their needs. Most of us rely on others for a variety of our decision making. How many of you have ever had to make a really big decision? Did you ask other people their opinion? Did you ask family to assist in your decision-making process? It's rare that any of us make decisions without input from our loved ones. It is essential to afford the adults we work with that same right. As social workers, we should include and respect the ideas of family members, significant others, and social or civic groups that provide support. It is important to acknowledge here that the key word is healthy supports. The only time we would not give family or other supports the same priority is if they are the perpetrator or contributing in any way to the maltreatment alleged. Always take your time and provide due diligence in seeking out all family and support services. We never know what someone will do. An adult may feel that their child would never move from another state in order to provide them with care. But when you speak to that individual, it's actually the first thing they would do in order to assist their loved one. Never assume what families will or will not do for each other. Our next principle, number 5, is one of the harder principles to practice. Inadequate or inappropriate intervention can sometimes be more harmful than none at all. Just as we talked about in the previous principle, the least restrictive plan should always be used. Overly restrictive interventions can cause digression in the adult, physical trauma, or even physical pain. APS workers should always know all of the resources available to them when mobilizing services. Would you recommend counseling to someone who did not have a psychiatric diagnosis? Would you recommend chemotherapy for someone without cancer? This same concept applies when mobilizing protection. A good example of inappropriate interventions is when caregivers add medication symptomatically. They give a medicine for certain side effects, which turns into a medicine for another side effect, and the flow continues. Instead, they should have a thorough review of all systems and have a plan outlining the least amount of medication interventions needed. Another example is placing an adult in a residential setting like previously discussed, when all they may need is in-home services or SA in-home. Placing an adult can result in tremendous withdrawal or depression, and sometimes even an early death. If you are unsure of the intervention to mobilize, then do not give any and staff that decision with your supervisor. The sixth principle is that protection of disabled adults is a shared community responsibility. It is absolutely critical that the community and local agencies work together to improve the lives of disabled adults that have been abused, neglected, or exploited. The community partners in your counties should be aware of APS and the priority that APS should take. DSS usually takes the lead and the community should help. It is always recommended to establish an MDT as cooperation is needed at every step of the APS process. General Statute 108A, Section 103B, addresses the responsibility of other agencies assisting APS services. As social workers, we are stewards of information and service brokers to the resources that exist for adults to access. It is incumbent upon all of us to allow adults, to the best of our abilities, to age in place. Take the lead in your communities and provide education to your stakeholders. Our seventh principle is the concept of emphasizing that the focus of APS is whether an adult needs protective services and is not investigating an incident. Adults have the basic right to be protected from maltreatment, so leave the legal work to the legal team. You are not there to determine charges to a perpetrator or their criminal liability. A caregiver may neglect an adult unintentionally, and they only need your resources and education. You are responsible for evaluating the adult in all 6 domains, something we cover extensively in classroom training. We must keep that evaluation person-centered to the adult and not the perpetrator. Unfortunately, one incident may lead to bigger issues. Concentrating on only the one incident may not uncover other maltreatments happening to the adult. We want to provide as comprehensive of services as we can. We only can stop maltreatment with effective and protective interventions. Our last principle, number 8, is that adults have the right to confidentiality and their privacy should always be respected. Adults' personal information, interpersonal relationships, physical environment, or lifestyle should be kept confidential at all costs. We have a duty to protect that privacy, and confidentiality is a pillar of social work. The reporter is not privy to any information during the evaluation just because they made the report. The same is true for caregivers and even doctors. While we appreciate the concern, it's also not their right to know what we find. The reporter may receive notice on whether the report was accepted and may be a collateral for information. We can ask many questions, but we often cannot give answers to caregivers and family unless the adult consents. Equally, the adult may not know who made the report. Reporters are immune. Even if the reporter tells the adult they made the report, you cannot agree to that statement. Written consent is always best to have when an adult is allowing their information to be shared. We should never confirm that an adult is being evaluated by APS, as it is intrusive, and adults may feel shame in persons knowing that information. The only way it should be shared is if it is necessary to do for service provision or collecting medical and financial records to confirm maltreatment. We have now gone through the 8 different principles of adult protective services, our guiding values in service provision. We have interwoven the ethics behind these concepts and provided examples of how these principles may manifest. At this time, you will complete an activity, Handout B, titled The 8 Principles of Adult Protective Services. The goal of this activity is for you to analyze yourself, as well as speaking with your colleagues and supervisors. You should answer the 3 provided questions for each of the 8 different principles. Those questions are: why is this principle important? What are your own biases and challenges in practicing that principle? And how do you feel you will apply this principle in your daily practice? Please take care and consideration when evaluating yourself as it pertains to this population you will work with. Feel free to provide examples or times you have dealt specifically with those principles, and ensure that you collaborate with other colleagues and your supervisor. Good luck. Thank you.